طيب السلام عليكم ورحمة الله جميعا. Welcome to this important talk. We are going to listen to Dr. Thuraya Gattan in a very, very important topic actually in the medical education, mainly about the use of multimedia in teaching and assessment. Also, cognitive load effect of multimedia, item analysis in the testing, and also in the selection of the multimedia material during teaching. Dr. Thuraya Gattan is a medical doctor, graduated from King Saud University. Then she got her Master of Medical Education from King Saud bin Abdulaziz University for Health Sciences, followed by a PhD from Plymouth University at UK, with the focus of the use of multimedia in MCQs. Her PhD title was Exploring the Validity of Multimedia Written Assessment in Saudi Arabia. Without any further, we'll give the mic to Dr. Thuraya Gattan to start, please. Dr. Thuraya, would you please start?
Assalamu alaikum jami'an. Thank you, Dr. Hatem, and thanks everyone for coming to this webinar and taking the time to attend. Hopefully it will be an hour or a little less. We'll see how it goes, and mostly we'll be focusing on talking about multimedia. I want to say that most of the material coming out was as a result of the outcome of my PhD project, and with the current situation and shift to using online materials and assessment, I thought this was an opportunity to share some of these results. So we'll start the presentation, but I think I need someone to stop sharing the screen, Dr. Hatem, because it's not allowing me to share the screen. Or maybe Jihan.
Jihan, if you stop sharing the screen, if you don't mind, please.
So we'll wait for. It says you cannot screen share until the other participant stops sharing. I think until the we have to see what's the technical problems. Okay, so I think I'll just give you an idea before until we finish this technical problem. So the idea is that we want to talk about the use of multimedia in training, and it's usually in the training is a big word, so we're talking about assessment and teaching and learning, and the objective of this talk is to first we want to discuss the potential and drawbacks of multimedia in this okay, 1 second, I think I'm able to share the computer, so let me just put up the slide and then I'll share the can anyone see, can you all see the presentation, or is it showing or not showing?
Not yet.
Okay, so let's try it again. This is the technical aspects. Okay, so I want to share. Okay, for some reason, it is not showing the PowerPoint, so. I apologize for this. Just give me a second. can you see the screen now?
Yes.
Okay.
Yes.
So I'll just have to put this into presenters mode, and we can start. Okay. So we're talking about, so we said we're talking about the objective of this webinar. So we're going to be talking about the potential and drawbacks of multimedia. We want to talk about the principles of instructional design for using multimedia. What's the effect of multimedia on the item analysis? And we want to explore factors to consider when selecting multimedia. So because this topic has to do with a lot of the cognitive psychology area, we're going to go around the important concepts. So first, we're going to start with the definition, just what is multimedia learning. So just from the Oxford Dictionary, generally, it means you just want to use more than one medium of expression or communication. And in computer application, it's the idea of using audio, video, and interactive materials with text. Amy published a guide that was talking about using multimedia, evaluating it in medical education, and it defined it as a courseware which integrates video, audio, and graphical material with text and number operation. So just the idea is we're talking multimedia about here images and videos. We're not going to artificial intelligence or the virtual reality. We're talking about basics, image and videos. So of course there are benefits and drawbacks. And so briefly from the literature for teaching, the benefits of it using multimedia, which is image or videos, it's that it's interactive. With the students, it clarifies difficult contents and concepts that are difficult to explain verbally or by text. There's a literature that says it's a good literature that said that there's better retention of learning for the students. It provides more information than text when you display the information. It has a good motivation role where it captures attention of the students. It simplifies the abstract and complex concepts. So if you're talking about like micro things you cannot see, especially in the medical field, there are so many videos out there that show you things inside the human body that couldn't be possible when we were students. And so that's a way of using it. It has realistic scenarios that promote authentic learning. Now in testing, it gives you a whole wide of testing possibilities. So it's flexible and dynamic with items. So you can put more than one image. You can put an image and a video or an image and audio. And it helps in measuring higher cognitive thinking. It also helps in reduce guessing for those who know how to answer, of course, which helps reduces what we call construct irrelevant variance. So if you're giving a clinical scenario or a ECG or ultrasound, you're testing that exact same thing. You're trying to remove any flaws that might be in the question that will test something else. It improves the fidelity of item scenario. And it aligns more with the curriculum because in the teaching, there are lots of specialties that are visually oriented: pathology, radiology, OP-GYN, ortho. They use X-rays, ECG, cardiology, and so we need to align the teaching with what you're taking and testing. It's more representative of the actual work performance. So when you see an ECG image in an exam or in a formative exam, it's the same as when you actually see it in the clinical setting. And it's perceived as being realistic, more interesting, and less intimidating. For the drawbacks, so mainly the drawbacks in teaching and learning, also in assessment, is the copyright issues and the permission to use that. The students' learning style, so you have students who are visually oriented, some of them who are like to read, some of them who are auditory. So if you have especially a big group, you can't fulfill all of their needs. And that leads to that not all students can process image equally because each one will perceive that they have a different learning style. And then that's how not all of them will use the image in the same way. Other drawbacks is that it might be difficult to develop, it's time consuming, it could be expensive, and it requires different backgrounds. So you're going to have a background in understanding and the knowledge of it, different specialties, some a bit of IT skills, and so on. For testing, I think the big issue is like the quality of the multimedia. So even sometimes if you have it, you can't always use it properly. And that reflects on the technical aspects where the size of the multimedia is too big and it gets affected. The process of editing and copying it and then transferring it goes to security. These are all drawbacks. There's some evidence that say that the students or the examinees, they get emotionally involved when they see the clinical. So they get anxious, or they feel tired, or they get this emotions that sometimes affects their performance. It also alters, which may reflect and alter students' mental model and attention. And we're going to be talking quite a bit about the mental model in a few minutes. So its effects is unpredictable. That's why they say when you use multimedia, you have to be very careful when you use it. And I think the other difficulty is you want to develop a large multimedia bank, especially one that doesn't, it's not the same as your teaching materials. So going on to now the bits of concepts and theory. So the multimedia and cognitive load theory. So simply put, the cognitive load theory is a theoretical foundation that helps you to design your instructional material to enhance learning. So basically what you're saying, if you're going to give a lecture or a presentation, anything, what are the best ways to use the multimedia materials and able for the learner to receive it appropriately, has active learning, and stores it appropriately in his long-term or her long-term memory. So it gives you insights about how the brain processes work, especially the visual and verbal information, and that's what we're going to focus on. It outlines the difficulties a student may encounter when learning new materials, and how to design visual materials to enhance the efficiency and reduce the cognitive overload. And that's another concept we're going to explain now. So basically, so if we're going to talk the big picture, which is a picture, you have a static picture, which is non-movable, and you have a dynamic one that moves. Now, the static image is a single frame. So it's taken from a flow of motion. So you just take one snapshot of that. Therefore, it does not change. You see it as it is. Where the dynamic image is, because it's a series of frame, it's always continuous and changing. And the idea is that we need to take this into consideration, especially that we need to understand that when you present a picture or a video, the information about the shape, the color, the form, the structure, the size, it's gained all at once. It's not the same as when you read about it. You take the information bit by bit. And although even you're looking at the picture, you're looking at the hand, your brain is incorporating the color of the picture, that's in a circle, how many fingers, why the brightness of it, although you are not thinking about it, but the brain processes all of that. And that's something, one of the concepts that we need to understand. So other important concepts, the mental model or the mental representation. And this talks about the person's own personal understanding of a text or image that he already or she already knows. And it's influenced by your understanding of the world. So simply put, as this picture, if you have, so this is a picture of an elephant. However, each person in the picture, each character, from their view, from their perspective, from where they're standing, from their knowledge, when they perceive that part from that view, they have a different mental model. So each one has a picture of a snake because he's touching the trunk of the nose of the elephant. The other has a brush because it feels rough, and so on. And so this concept is what's important, is because like when you give a picture, an image, or an X-ray or an ECG, you might see it as a consultant as that certain diagnosis, but the perceiver or the learner sees it in a different way based on their understanding of the world, their emotions, their experience, their prior knowledge, what level they are. All these affect the mental model that we're going to be talking about. So when you construct a mental model or this mental image, there's two ways. You either construct it from text or from pictures. From text, usually if you're going to take it from text, they say that there might be a misinterpretation from the text and that might affect your understanding. So that's why when you read a text, or an item, you might have some misconception, and it takes more effort from your brain to process them and interpret it. However, when you take it from a picture, the construction is more direct, it's more easy to understand. And therefore, the idea of this whole multimedia learning is when you present a picture with a text, it helps you interpret the text much better and not go into that confusion. So other concept, multimedia learning, is just simply put, it's the act of learning from words and pictures, as we're doing now. The multimedia instruction is presenting these words and pictures to produce learning. So we're using now PowerPoints, we're going to use some images, and it's the tools that you are using. The cognitive overload is the idea that your brain has a certain capacity to gain information. And when that capacity is filled, it cannot receive more information. And you can simply think about it as a bucket of water. If you fill the bucket, that's your capacity. The more water you're going to put, the more it's going to flow out, and you can't have more information on it. And that's what we call cognitive overload. So the cognitive theory of multimedia learning is a subset of cognitive load theory. So there's so many theories, so many leaders and pioneers there, but we're talking about the multimedia, and it's based on 3 assumptions. The first assumption is called the dual channel assumption, and as the word dual means 2, it means that our brain has 2 separate systems or channel to process verbal information and pictorial. So we're only focusing about verbal and pictorial. So this is the first important assumption. The second assumption is called the limited capacity assumption, which means that these 2 channels have a certain capacity, a limited capacity to hold and process this information at any one given time. And the third assumption is called the active processing assumption, which means based on the information that we got from these 2 systems, we need to integrate them together in the end so we can have one meaningful learning outcome to occur. So these are the basic assumptions. So put in very simply, so these assumptions, so we're talking now about inside the brain. For the human information processing system, there are so many models. We're going with Mayer and his team, and they're cognitive psychologists. They've been in this field for more than 12 years. And the idea is that when you have information coming from the environment, so it's an input to yourself, you have either auditory input or visual. The auditory input can either come as verbal, where somebody's talking, or auditory, you're going to hear it from somewhere. And the visual is something you see. So it can be pictorial as a picture, image, graph, map, or visual format. So it's going to be video, animation, and so on. Now, we're going to go to a bit complicated how it looks like. And this is the simplest form. This is the cognitive theory of multimedia learning. So the idea is, basic thing that you have to understand, there are 2 rows here, the word row that I highlighted and the picture row. The words have to do with the spoken words. So you have ear and it goes to sound and so on. And then you have the picture. The other thing I want you to know is that there are 5 boxes. So the box of the multimedia presentation, the sensory memory, working memory, and long-term memory. So when you have a new information coming from the environment, it's going to go into a series of process for it. So this sound and words that you're hearing and seeing, it's not going to go into the long-term memory immediately. It has to go through a process. This process is called selecting. So you're going to select the words in the image that you hear or see, organizing, and integrating. So it has to go through these processes before it's stored in the long-term memory. Now, the first thing it goes to, so in the multimedia presentation, so it's the words. So the words that you're seeing now and the picture of this graph, that's how you perceive it. It has to be translated to the ears or to the eyes. So it goes into the sensory memory. Now, just mark here that the words have 2 forms. My voice that you're hearing now is translated into your ears. However, the words that you are reading on the screen is translated as a picture and goes to the eyes. So the words have 2 channels to go through, while the picture just goes as an image to the eyes. So after it goes, the words becomes translated into their senses, to the ears and eyes. It goes to the working memory. And here it has 2 phases, the superficial, then goes into the deep memory. So when your ears hear the word, it transforms into sound. And when you see the image, the picture, it becomes an image. And so the working memory chooses what of these relevant information to understand, and it translates it to either a verbal model or a pictorial model based on your understanding of life, on what your basic prior knowledge and everything. However, these verbal and pictorial model need to be integrated. They need to come together before they are stored in the long-term memory, which is our last part. And when it's stored there, it activates with your prior knowledge to make this to understand what you are receiving. Now, from this, there has to be 2 concepts I want to say, that your brain can have unlimited words and pictures, and it can have unlimited storage in the long-term memory. However, the problem is in the working memory. So your brain can only have a certain capacity of taking information at one certain time. So by the end of this lecture, some of you would have understood half of it, some of you might have understood most of it, and so on. The other thing I want to say, that we have to understand this concept, that the idea of multimedia learning is to try to avoid the words competing with the picture. And that's the idea where if you have a text and an image, sometimes the words will compete with the picture to go to your eyes. And then your eyes cannot, translating all this, cannot process both information. If the item is complex or the multimedia is complex, it won't be able to upload all these information at once. And that's where you might have cognitive overload. So we're basically sometimes seeing how to prevent this cognitive overload. So going to the instructional design. So what are the principles? Usually we present, the idea is now to present both words and pictures together rather than words alone, because that's how you maximize information. And it focuses all this on 3 ideas. We want to eliminate any external distractors so you can have a good capacity for your working memory to understand. You want to encourage the formation of mental model that fits the material, not something that's incorrect, that how like the people who have seen the elephant. And you want to facilitate the integration of prior knowledge with new material. So Mayer had 10 principles, and some say they have 12, and these are the main principles that we're just going to touch lightly. We're just going to talk about what they mean. We have the coherence principle, signaling principle, redundancy, spatial contiguity, temporal contiguity, segmentation principle, modality, pre-training, multimedia, and personalization. And then some say there has voices and image, but mostly the 10 are the most published. So these are the 10. We're just going to go simply to understand. So the coherence principle says that you need to exclude any extraneous words, pictures, or sounds, either from your teaching material or from your assessment or examination material. And these are all principles to make sure that we have a good learning and to not overload the working memory. The signaling principle, and I'm going to give you an example in a while, is highlighting essential materials. So it's like putting circles and arrows, like we've done in the image before, where I highlight where I want you to see what I'm talking about. The redundancy principle says, do not add on-screen text to narrated animation, which means, let's say you have a video talking about, explaining about how the blood cell works and so on. You want, and someone's talking about that video. You don't want to have text or written material that's talking about the same thing, because if the student is listening to the material and actually reading the text, that confuses them. So they're saying, if you have verbal material, don't put a text with it that confuses the student. Spatial contiguity, and as it means, it has to do with space. So if you're going to place a printed word, you need to put it next to the corresponding picture, so they're not separated from. So the space needs to be next to each other. The temporal has to do with time. If you're going to place them together, you need to put them at the same time, not one before the other, because that confuses the brain a bit. The segmenting principle has to do with how you segment the information. So as let's say you want to, instead of giving them a full, you give them in chunks. And they call this learner paced segment. So if you have, let's say, a lecture, let's say it's 15 minutes, you can give it into chunks of 5 minutes and so on. The modality principle says when you present words as narration or as spoken text instead of printed text is better. Meaning, let's say I'm talking now and I'm talking and I shouldn't put like these words because it's better for me to just verbalize it than print it. So they're saying when you can, make the words into voices instead of text description. The pre-training principles means you need to read ahead of time, prepare yourself, familiarize your students with the name, location, key concept, characteristics. So let's say like before this presentation, I would have sent you materials about multimedia. I told you that there's something called cognitive load. So you come knowing some of the keywords. The multimedia principles, it means presents words with picture rather than words alone. And the personalization principle means you use word conversation style in a friendly rather than a formal manner. And the other two principles that aren't written here are the voice principle, which means that it's better to use a human voice than a mechanical or electronic robotic voice. And the image principle says that if you're presenting something, you don't need the image of the speaker to be presented. Now, these are all in learning, this whole 10 principles. Now, how is it transferred to assessment? It's not really understood. Some of these, the one I highlighted in green check, have been used or accidentally used or intentionally used, but these are the ones that you can or was applicable. But still, this area from taking it to teaching and learning to assessment, there's still a gap in this area. So These are the principles. Now these principles have sub-principles and sub-principles and sub-sub-principles, and there are lots of factors that affect. So I just highlighted the main understandable ones that we could apply, and we're talking about the position of the multimedia, the prior knowledge, what we call spatial ability and orientation, using animated material, a redundant multimedia, and constructing cognitive schema. So we're just going to go briefly on all of this. Now, the position of the multimedia, the image or the video, you can either put it above the text or below. If you're going to put it above, which is much recommended, it says that it helps activate prior knowledge. It helps in recall and understanding, organizing the text that you're going to read, because we said when you present an image, it's easier to understand by the brain. It has less working on your memory. That's why it requires less cognitive effort, which means it leaves more space in your working memory to process the text. However, if you start with the picture first, if you start with the text first, sorry, and the picture below, then your brain is going to try to develop a mental model based on the text. So you're going to read the text, you're going to try to understand what it's saying. Based on what you read, you're going to make a mental model, an image about what you read, and then you're going to get hit with the picture. And then whatever you created in your brain from the text might not be matching with what the picture that's being presented. And therefore, you have already used your working memory to process the text. So now when you're hit with the picture that doesn't reflect what you're reading, you cannot process it because you've filled the capacity of your working memory. And that's the concept that we're trying to avoid, especially in examination. Now, so the idea is that if you have visual and verbal system, we get maximum information. So this is how you can present information like in an exam or something. So they call it the split format, and there's a segmented. The split format, the idea as it's shown, you have the clinical scenario and question on like one side of the page and the image on the left side of the page. The integrated format is you have it all together. So you can have it before it, and then you can have the clinical scenario. You might have after the clinical scenario some images, and it's integrated, where it means it just follows a certain sequence. And these are what's recommended. So that's for the position of the picture. For prior knowledge, the idea is when you have prior knowledge, it's used to select relevant information from the multimedia. So when you have prior knowledge and then you get the new information that we talked about, that's what's going to help you to make your mental model. And this determines how easy a learner can interpret the visual representation. So the more knowledge you have, the more easy you can make a mental model. So the more practicing you have. And this depends very much on the learner's level of knowledge and the expertise in the content area. So it means if you have novice learners, they're not going to be very great at making mental models. They're going to take more time. They're going to have more confusion. And the experience, the more experience you have in the content area, the more your brain is used to seeing stuff and storing this in the long-term memory and making it a proper way to interpret anything that's coming next. The third one we're talking about is the spatial ability and orientation. So that talks about the ability to rotate the image mentally, which means when you see something, you want to make sure when you read something or you see something, you have to see how your brain processes it. And let's say, give you an example, this depends on the viewpoint, if it's a 2D or a 3D image. So if some people might, when I talk about a heart, they might just the simple basic heart. Some might think about it as a 2D dimension. The more think about 3D, and then the other one has the image in their brain. So we talk about in teaching and learning, we should always go to the what reflect what we're doing. So like in medical, or let's say in anatomy, when you're speaking of anatomy, you should show the image of the heart on the far right, the movement, the one that's rotating, because that's what we want. And so when you have an exam, you need to make sure that that reflects what you're showing. You can't just in the exam, let's say, show a picture of the heart, the simple heart, and ask the student to answer. Well, it makes it difficult for them to interpret it. The other thing we have to think about is the image cut or frame selection. So as you see, this just as a cut of the image. The first one is a single cut, or what we call a static image. The other is a dynamic. Now, in training and in clinical practice, the students and the residents are used to seeing so many cuts, like in the CT or in the MRI, and they go through up and down, and that's how they are taught. However, in the exam, we give them a single image, and that single image in that point of time confuses them and helps and sometimes makes it difficult for them to process the information, or they feel that the information is missing because you just gave them one single image and they want to see the relationship of that image to the rest of the organs. They're not sure this organ is cut at what level. The other thing is that affects is the visual ability skills and the working memory capacity. So the more visually you train your students or you practice to see stuff, the more you will be able to interpret it. So basically here, the LAS and the HAS, which we mean the low ability students and the high ability students, some of the literature say that the low ability students actually have a lower capacity in their working memory. Therefore, it is difficult for them more than the high ability students to interpret the image. However, they also say that the low ability students prefer or do better in multimedia image than if you give it to them as a text. And so there's some recommendations say that when you're going to give a cut of an image or some cuts of a motion picture, you need to include the significant and non-significant views to avoid queuing and to help them understand where the image is. That's if you cannot put the video. Of course, the ultimate is, or the best thing is to put a video if we can. So this is an example of one of our items that we had used. So based on a pilot we had done, where we gave an image with a question of the ECG on the left side, and then we had the text format. Now this was talking about ECG and I can't remember the exact question, but it was about reading the ECG, and we had put in the text item like ST elevation and in V1 and V2, and we just explained to them. Now the idea was when we were looking at the item analysis, the image picture, as you see, it has 83% difficulty, which means 83% of the students answered it correctly. However, in the text version, only 70% answered it. And then when asking them, just simple, these are just some of the comments that they had said. The ECG, the students had said that the anatomy, when they see the ECG strip, it's as if they're seeing the heart on it. So they say it's better because we're already seeing the ECG paper and you have it in your mind how to relate it to the ECG. And so they can position this anatomically. And this is what we're talking about, spatial ability or orientation. However, in the text format, some of them said that you gave me missing information. Right, you gave me the highlight, but they felt that you didn't give me the height of the waves. I didn't see the squares. There are some waves you didn't mention that they're used to seeing. And so we gave them an ECG written script when they're used to seeing the ECG. And so giving it to that as text, they had to read the text, try to imagine it, interpret in their heads, and then that's where they might have not answered it correctly because we confused them. And these are, I think, some of the things we think we should pay attention or start to pay attention when we use multimedia images. How does it reflect in the item analysis, and what does it truly mean? So the other thing we talk about is were the image colored? Was there any landmark? So if you're going to give an ECG black and white, it's different when you give it as a colored. You can see as the squares aren't seen well, and these are the missing information that the students seek when they're learning or when they're taking their examination. This is just an example, of the integrated format of an item. So you just put the image and you have your questions. You can label it inspiratory from expiratory, and labeling is important. And this is just a simple example. Other examples. So we're talking about the segmenting principle, and that's when you highlight something as this picture showing. So if you're giving this a teaching session and this yellow highlight is highlighting what you want to, the signaling principle, I mean, as how you want to highlight the information to your students. For the view and color, because it depends on your view or your expertise. So if you're an expert, you might be able to see the abnormality in the first picture on the left, picture A. However, there are different technologies and grid technologies and so on that makes the image even more clear. So depending on how you present the image, you can present one image to the students. Some of them will see it and some of them won't, and it becomes how they see the image, especially when they view it on the screen. It might not be clear to some. Other thing is, excuse me, if you had a video and you wanted to take a cut image. So giving the video is much better than just giving a single image. So so we talk about now exposure brightness of the image. And so one of the thing called segmenting principle is when you want to give something in segments, you can either give it as chunks, or you can give it in slow motion or in a longer time. And so this is like one of the things that you could give, that they can change the brightness of an image, let's say that in an examination, so they have that option to see, so the information can be segmented for them. The student's view, as we said, you can give an x-ray that each student can view it as differently, and so some would find the marks and some wouldn't find the marks. Another example is this one. Let's go back, I think. And see if you could hear. So this is just a question where you can use more than one. And as you see, you can add an audio and a video. And the thing I want to pay attention, so if you just listen to the audio, you will hear at the end it loops again, it starts again. Another example, an image with a video with an audio. And so you just keep on repeating it on and on. So these are just examples of using some of the audio and images. So going to using animation. So when you want to use animation or any video, you need to make sure that something called interactive control. So if it's in teaching and learning, they might have play, stop, or even an examination. If you're going to give them, as we just showed now, they can have the play button, they can have the pause button or the repeat. And these are important because if you don't have these, they might get confused. However, these tabs need to be explained to them, and you need to prepare them to have this so they can understand it. The clip. So what clip are you going to use? Are you going to use it a whole clip or a detailed clip? Now there's some evidence says that if you make the clip too detailed, they're going to have multiple viewing, and because they're going to try to analyze this very short clip to find the abnormality, and it might cause a confusion and waste their time. So you have to think about increasing the time of the examination. You need to pace your video according to the learner pace segment, as we said. So if you're going to give an image or if you're going to give an audio, you need to make it simple and simplify the video, or you might just keep the information longer on the screen. When we talk about looping, it means like, let's say the video is 10 or 20 seconds. After 10 seconds, it starts over again. That's what we call looping. Now there says if you're going to loop a video or an audio, make it loop once and then give the options for the students to loop or not, because sometimes if it keeps on just repeating and repeating itself, the learner or the examinee gets confused, they don't know how to stop it, and it just affects their interpretation of that video or audio. The last thing is we say that if you have an animation but a simple image is better than the realistic animation, then just go for the simple image. And we'll give it an example here, where we had in one of the Opigaini questions with Repiloted, where we had a video of an ultrasound and with questions, and then we had a text version. Now you can see the difficulty. For the multimedia item, it was 34%. It means only 34% of the students knew how to answer the question. And the text, 72 knew how to answer it. And when we asked them why, they had said that the video was too zoomed, it was too short, the looping confused them, and we would either prefer it as text or have it as an image. And I'm not sure if it will work, but this was the video. And you can see, so it starts for a few seconds. I think it's like 10 seconds. And then in the middle, it starts all over again. And then, so they didn't know that this was looping. We looped it for them like 3 times. So we repeated it 3 times for them. And they had said that the problem also with this, that they are used to, in the clinical setting, they're holding the probe, they're aiming it, they know where to move it right or left. In the multimedia, they said, you didn't show us where the probe is, we don't know which section is of it, and so there was no labeling and there was no probing. And then I think that's one of things that highlighted that we need to make sure that if you're going to make a video, and this is where we say we had a detailed clip, you might need a bigger clip and a longer clip, and make sure that you loop it only once and give the option for them. We have to make sure we tell them where the probe is, and like label them, where's the top, where's the bottom, ventral, dorsal, and so on. When we go to the other factors, irrelevant or redundant multimedia, you have to understand that information is maximized when irrelevant information is removed. So anything that's not necessary, we try to check it out. So the content of a multimedia, so when you put a multimedia, like we just put the ultrasound, can either add or remove information from the scenario. So sometimes you can, sometimes the multimedia that you add might burden the working memory and cause cognitive overload. And an example was that when we gave an image for, I think, a kind of skin disease, the picture was too zoomed in. And then so it was zoomed in on a pediatric patient, and it was too zoomed on the nose, so the nose became big, and then the student got distracted by the size of the nose of the picture, and the runny nose, and the pimples on the kid, and they didn't focus on the rash, because those were the extra information that the image gave. However, in the text, we just wrote the description of the text, let's say macular papular rash. So they didn't get this extra information, the big nose, the runny nose, the extra skin lesions that were on the skin. The other thing is that sometimes accidentally, so these extra information accidentally alters the intended construct under measure. So if you want to test them understanding this, they're going to go think, oh, why does he have a big nose? Or why does he have, why is it too zoomed in, and so on. And that was clear in the zoomed image. The other thing is duplication of information. So it says it's not to duplicate information, meaning that don't give an X-ray or an image or a video and then interpret it or explain it again, either in the teaching or in the text, because that means that the information is going to be presented in two different forms, in a text version when they're going to read it, and in the image where they're going to check it. And then so the information is going to be processed twice, and they're going to be cognitive overload, and then you're going to have the attention split between these two, and then one or the other is going to be competed, and it's going to affect their understanding. The last one is the constructing cognitive schemas. And that means it's like the same thing as mental model, like we talk about the illness scripts, how you diagnose things, everything you've been used to and you store in the long-term memory, they call it like cognitive schemas. They're like diagrams and maps and things you store. And this depends on, as you said, spatial ability, how you interpret things mentally, how you see things 2Ds or 3Ds, and it's based a lot on the prior knowledge. So the more you have of this, the more skills you have of practicing, and the more prior knowledge, the more you can have better cognitive schemas in your mind, which helps you have a better mental model, which helps you have a better capacity in the working memory and decreasing cognitive overload. The interface design principle talks about how materials appear on the screen. So most of the materials of the multimedia has going to be a form of screen, either iPad or iPhone or computers, or even projectors, and the appearance of the multimedia on the screen affects them. So either by the color of it or even how you present it. So you're going to present one question at a time, more than one question at a time. And the idea is you try not to overload or crowd your screen, or if you have an item, try to present one item at a time. It also, so the cognitive schema also depends on the level of the reader or the examiner. And so you have experts and novice. And I think this is where things sometimes go south or west, with north or south, is because the expert, they have a very global focal search pattern. So they see things generally, and then they know exactly where to look in the image. And that's because they have a rich knowledge base, and therefore they require very short viewing time. And so when they present a material or present an item, they say, oh, this is very clear. They should know this X-ray. They should know this finding in the ECG. However, the novice have very superficial search. They're not used to this. They only have pieces of information that are weakly linked, and they call this fragmented knowledge. So it's all over. And that's why they take longer viewing time. So what you think is very good and a very clear image, to them might be something very difficult. And I think this is where we have to sometimes take the inputs of the students or the examinee. When you put an image, was it really clear, or is it clear for experts, but at their level it wasn't clear? Other things for the cognitive schema is the instructional guidance and explanation. So you need to prepare them, you need to explain to them. In examples like in OSCE, when you have a format for the students and you explain to them. If you're going to present a new way of examination, then you need to give them, have an orientation session, you explain to them what they're going to see, because that's going to prepare them to understand what's coming. The last is the language format. So the idea is when you have multimedia in a learning or a teaching, it's not singled out. It's the interaction of the multimedia with the text, with the person. So they call it the item person interaction. And how the person interacts when they read the item and when they see the multimedia. So it's advised, like when you have exams or even presentations, like to try to limit the sentence length. Whenever possible, you need to view your word selection and your vocabulary very carefully. You need to include terminology students are familiar with. And there was like an article about the nursing examination where they had an item presented. They're talking about an injection site, and they used the front aspect of the forearm, and students didn't understand that. And then when they went back to the book, the terminology that they're used to is dorsal and frontal. So not using the word dorsal and ventral, I mean, that's where they got confused. So you have to use things that they are used to in their terminologies. The last thing is that certain terms or phrases might cue the underlying disorder, so that might confuse them. And these have to do everything with the item writing flaws and how to write proper MCQs. So that's all what we talked about is the principles and the factors. Now, with all the information that we have, we're just going to talk about how to apply it in testing, or what things to look for in testing or to think about, and about the psychometry or the item analysis. Now, the literature is not, there's very few that I could find for using multimedia in testing. I found 2 articles, one in 1999, and this one is the latest that I could find, or that had a comprehensive view. And the idea is that it covers 4 aspects: the student's perspective, the technical issues, the faculty's perspective, and the content. And these aspects cover the successful implementation of multimedia testing. Now, they presented it as a series of questions for each one. And I'm just going to go the questions on what to think about. So the student's perspective. So they said you have to think about what do they think of multimedia testing. So you need to know your students' perception. What are their learning styles? Are they comfortable with it? Do they have an anxiety towards it? Yes or no? Because that plays a factor in understanding stuff. Will it help them learn the concepts better or not? In what ways can the multimedia testing help them learn better? So how does it help them form their information and learning? Will taking the multimedia test require a lot of computer skills? So that has to be taken into consideration in training them. And is it fair to use it when some of them don't have computers at home? And this is an issue of fairness, and I'm sure a lot of us are facing this right now. So this has to be taken to us. So these are the students' perspective that they said you have to think about in testing. When we go to the faculty's perspective, what do they think of it? So what do they think of the use of multimedia learning? Are they trained to it? Do they feel comfortable using it? Do they feel comfortable talking to a screen or not? Are they comfortable making the multimedia test? So making a presentation is difficult enough than trying to think of making a test. What knowledge and skills, equipments, and materials do they need to make these tests? All these have to factor in testing. Will creating the multimedia test take more time? And are they willing to spend the time to create these tests? Because definitely just writing a multimedia exam is an item takes a lot of time. So you have to consider putting multimedia is going to take extra work and extra time. Do they think it's worthwhile? Is the outcome better? Is the teaching better? Are their clinical skills better or not? And do the majority of college faculty have enough computer skills to create the multimedia test? So they have to also take some training. Going into the content itself, should the exam of the multimedia be the same as the paper version? And if yes, why? And if not, then why not? So if you're giving a multimedia exam and you have to have a backup paper, how is that going to work out? And so that thing you have to factor in. In what way can the multimedia testing enhance the paper version? So what's the difference? If you gave an image on a computer or an image on a screen, let's say, if you're just using an image and that's something you can do, is it better to give it in multimedia format or not, in a computer or not? Is it better to give a video or not? Or maybe just the use of the image is more better for this question than a video. And that things you have to consider, and that has to go into trying to pilot and see the psychometric of the items in two formats. What capabilities does multimedia provide? What are the materials do instructors need to create when they have the multimedia test? So you're going to have to think of some editing software, or even as simple as Windows Movie Maker. How are you going to loop? Are you going to move the audios? How are you going to edit? And so on. What materials do instructors need to create the multimedia test? So what do they need? Do they just need simple multimedia bank? Do they have that? Do they need special tools or softwares that they need to download? And how many times can the instructor use the test after creating one? So if you're using a multimedia, can you use it more than one time, that image, or not? And those are questions you have to ask. Of course, if you have a scenario, you can use, let's say, an X-ray of an adult and have that scenario. Then you can change that X-ray to make it to a female pregnant and just tweak the item. But then again, you have to think that image, how many times can you use that image in either in different scenarios or in the same scenario? The fourth aspect they talked about was the technical issues. What equipments, hardware, and software is needed? And that also includes like the testing centers or the softwares that you need. Is it secure? Do you need to compress the videos because that's going to affect the quality? Is it going to be difficult to upload? Are you going to upload it on an online database? Are you going to put it on a Google Drive? Or how are you going to transfer? And this goes into the issue of security. Is it easy to grade it? And how long will it take? Is it different when you grade it or not? Especially if you make it an MCQ, it could be easy. But let's say if you put an item and you want them to name two symptoms or two features, is that going to be easy or not? In what way will grading this multimedia test be faster and better than the paper version? And that's something you have to take into consideration. Is it worth it or not? Will it save manpower? And yes, if yes, how much? And will it not? Will it need more people? Because you're going to have to think you're going to need technical IT people. You might need to have more people in the specialty around. Is this technology reliable enough to provide multimedia testing on a large scale? Yes or no? Is it powerful enough to realize the capability of multimedia? So when we do it, is it going to tell us anything good about it or not? And this needs that you have to analyze not the items, and I think not just quantitatively, but even qualitatively, where you have to ask and get feedback and dig a bit deeper. And to make multimedia testing available to a wide audience, what factors should be considered? So when we're talking about learning or even examinations, are you going to open the webcam in the computer? Are you not? Do you need to add a lockdown screen or not? And so on. Other issues to think about: financial issues. How much will it cost? What manpower you need? What's the cost of adding time? You're going to add students. Maybe you're going to have a third party who can do that for you or publish. And the last thing is the outcome and the impact. So what are the consequences of its use? So you have to pay attention if you're using multimedia in testing. The item that you think might be very good might be a problem and pass or fail someone because of issues that we talked about, or because of cognitive overload, or because of things we didn't pay attention to. So what are the consequences of its use? Are we sure about it when we're using it? We've done all the validity checks and quality checks. How does it impact teaching and learning? Is it rewarding or not? Do the students who take multimedia exams are better in the clinical OSCE or OSPE or something else? Does multimedia influence assessment, and in what direction? And what's the impact on the psychometric characteristic of the test item, which we're going to go to our next stage, because this was a bit confusing and there's a gap in the literature in this area. So when we talk about multimedia and item analysis, I'm not going through the item analysis itself. I'm just going into what my observation and was on item difficulty and discrimination and duration, very simply. So technically, it seems to be unknown because it's everywhere. So I've done in this research, we've done a semi-systematic review of using multimedia in testing with 72 articles that came out. Only 11 came about talking about a text item, and it's matched by a multimedia item. So it means you have an item. The first item is text, so the features are written, says X-ray shows blah, blah, blah. And then the other format was an image of an X-ray, and it was given to students, and then they compare, because that's the only way we could know what is the impact of the multimedia on that. So you have two parallel format, one in text, one in multimedia. So from these 11 articles, 2 said that multimedia was more difficult. 3 said that there was no difference, and there's no difficulty in between difference in the text and multimedia. However, if there was any difference noticed, it was in the multimedia. So the multimedia was more difficult. 3 articles said that their experience, or said that the multimedia was easier than the text, and 3 had mixed results in the difficulty level. So they said, we don't know, some of the texts are easy and some are difficult. For the discrimination, the same thing. 2 articles said that multimedia was more difficult and discriminating. 7 said that there was no differences, and if there was a difference, then multimedia was more discriminating. And 2 said that it was less discriminating. And so, but they all seem to agree that using multimedia, image and video carefully, selecting it carefully, was better because the scores seem to be greater. It increases the face validity of the item. It seems to be more discriminating than the text, and improves diagnostic accuracy in novices and experts. And these are like some of the validity evidence you look for, or we can look for when you compare these two with each other. So from the research observation, from the research that we've done, what our conclusion was, what makes an item more difficult? So multimedia items we're talking about. So if an item was not clear, so the content was not clear, it affected the examinee's ability to identify, so it became more difficult. If the quality of the multimedia wasn't clear, it was vague, it was pixelated, it confused them, it affects their ability, so they couldn't identify the relevant information. So it was more difficult. The more authentic, so even if you put the more authentic, so if you put a clinical examination, which was very good, it was more difficult for them, of course, because there was no hint. So if they didn't know information, it was more difficult. And maybe that's what we're aiming for. We're not aiming for a very difficult, but they're saying the authentic, the good questions, there was no hint. So if you either heard the audio, you would know it. If you don't know the audio, then you're not going to answer the question. Testing higher cognitive skills. So the items that were more complex, the multimedia items, they were perceived as harder because they felt it was testing something more of analysis and evaluation. If it replaced textbook terminology. And this is where they had said that sometimes multimedia items, so if they're used to, let's say, an example, reading in the book the thumb sign, and they associate the thumb sign and the X-ray with epiglottitis, they're used to that. But when you gave them the multimedia and they don't know how to read that, and they expected to have the word thumb sign, but they got the image, that made it more difficult because they're used to seeing the text version of it. So when you gave them the actual multimedia of a text, of a terminology they're used to, it was difficult for them. If it had no relation to the item, so if you gave a multimedia and it had nothing to do, or you thought it had something to do, but it actually didn't, it made them confused and it was difficult, so they couldn't answer the question. If it contained redundant information, unnecessary information, so there was unnecessary processing of the information to the extent that they couldn't process the item itself, and so they couldn't answer it. If the image did not fit with the verbal material, and so, as we said, it could either not be related or it's duplicated, so they got a split attention, and that's because the text is competing with the image in your brain, and they're like fighting with each other, and then your working memory is overloaded with the words, and so it cannot process the text. Cross-sectional image, so most of the cross-sectional image, or the articles that came through, they said that it is more difficult. Some said it because it's processing unnecessary information. Some said because it had more interpretation, so it was more difficult. Other factors lacked labels. So if you didn't put enough label, like the ultrasound we showed, we didn't put where the probe was, they didn't know the direction, so they didn't have enough information to process. It perceived more difficult, so they couldn't process the rest of the information. If the video was short or a looped video, there's not enough time to process the information, so it just starts, and then within as soon as you see the video, within 10 seconds, it just starts again, and you don't have time to process it. The spatial orientation, if they didn't know what they're looking at, so sometimes we put some images or ultrasound, and they didn't know what part of the body was because we forgot to label it, and they didn't know where is it in relation to the other organs, so it caused confusion. And was more difficult. The students' expectation, which was interesting because students, although we did them orientation, they thought that when we give them a multimedia, it's going to be the classical presentation or an exaggerated version of it. And when we gave them a simple version or a normal, they were shocked. So they felt it perceived it difficult. They said, oh, we expected you to give like if we're going to give a rash, we're going to give a very huge rash or a very classical rash. The learning style, as we said, if someone is not a visual person or an auditory, it depends on how you perceive it. That's going to make the item more difficult. The choice of words, again, as we said, some textbook terminologies is replaced with multimedia. Again, this is just an example of an image. Usually if you zoom in, you have to make sure like when you click it, it can be zoomed in. Our idea was that here, if the image was small, you can just see the image immediately. You can have the choice to click it or not. You can see the text. And if you're going to enlarge the image, you still have the question and option. We thought that that might be a good version. So you have the text information in your mind, you process the image, and then you have the question and options there. Now, when was the multimedia easier? When the visual skills and when students who are visually like to see stuff, or like there are some specialties that they're used to seeing ECGs and they're used to seeing X-rays, they perceived it as much easier. Their clinical experience, so the more experience, the more easier it was for them. So you'd see senior residents had easier, it was easier for them than juniors. When the content involved motion or movement, and I'm going to explain this. So if you have something that shows a movement, like hip movement, flexing and extension, that's definitely better giving it as a multimedia. It's easier than explaining it as a text, and I'm going to give an example after this. If the image was so clear, they're used to it, it acted as a key to the answer, and that's okay. It's just because it was so clear to them that this is what we want and this is what we're used to seeing. Of the pictures where mental models is directly formed. So there are some images and videos that are so classical that as soon as you see it, you can just immediately have a mental model in your brain. And of course, the last thing is the learning style. Some residents had said that when we see the picture of, let's say, pneumonia, to them it was recall because they just recalled it from the images from the book. And that had to do with their learning style. This is about when we're talking about movement and video. So we had one of the items that had, there was a tendon injury in the finger, and the text format had said on hand examination, the patient is unable to actively flex the distal phalanx when the middle phalanx is held in full extension by the examiner. And of course, in the exam, the students were were holding their hands and trying to do the examination on themselves. And these are the persons who took the text format. The multimedia format was easier for them because we gave them this video. So we actually gave them the presentation. And so this image, this video question for the same item did much well. So it was much easier for them. And that's because when you're trying to explain a movement, you should show it to them as in real life, then explain to them flexing and extension and distal. And because whatever they read, they might read middle phalanx and then flex and then active, and then they just mess up the whole idea in their brain. So we go, that's the difficulty. So we go now to discrimination. Discrimination talks about how the item, when it's performed or when somebody answers it, does it show the difference between the students who are high ability, who know, or the good students, from the low ability students, the weak students. And so because this was all over, the factors that we could find, that is when the question with chest radiographs or cross-sectional images, although it was more difficult, it was more discriminating. So people who knew it actually knew the answer, and who didn't. So it showed you who are the high ability and low ability students. Fracture images, although more difficult, they felt that there was no improvement in discrimination. This is from literature. Item difficulty. So if the item was a medium difficult item, it means let's say 45 to 75% of the students answered, those was medium difficult. It was more discriminating. So very easy items and very difficult were not more discriminating, the multimedia items. Item cognitive level. So when the item was more complicated or more analytical, it seemed to be more discriminating. And then there's this whole big area of unexplained, where they don't know what was the difference. Why are there differences between the discrimination? There's still a big area in this section. For the duration, I think we'll all know that it does take longer to answer. And you have to make sure that when you have multimedia images, So even in teaching or in examination, this small extra seconds or minute compiled together has a big impact on examination. And why was the duration longer? Because they felt it was more complex. The difficulty level of the item was hard. They had to search more for the clinical signs. They had to repeat the video because of the looping. The quality of the multimedia wasn't good, so they had to repeat it or just stare longer at it. They needed to spend more time on the image to extract the relevant information and understand it. They needed to orient themselves anatomically and what's the structure and the spatial ability to understand. And sometimes when the item had no relation and they couldn't make a link between the items, so it wasted their time. When was it quicker to answer the multimedia questions? When it was very clear. So it made the item very easy. So less time was spent on trying to analyze the text. And so they got the information from the multimedia immediately. When there was not enough time to answer all items. So these are the speeded tests because they had so many items and they need to do quickly, so they just answered anything when the item was too difficult. So sometimes the residents said, we know it's too difficult, we know we're not gonna answer it, so we're not gonna waste our time answering it, so we'll just put anything, and that's how they answered it in seconds. And when it resembled clinical settings. So when something reflected, so a lot of the residents in the ER said that when they see the ECG images and the description of the procedure, it was as if they were in the clinical setting, so it was very easy for them and quicker for them to just answer. They felt that they were like in the clinical setting. So 3 issues regarding time. The residents felt time restriction to complete the item. So although they completed it, but they always felt that there's time restriction. The other thing is that those who completed the item didn't have time to review it. So they might have finished all the items, but there was no time to review, and that wasn't taken into into consideration, where you have to put that in time in mind. You need to allow for additional testing time to make sure to strengthen your validity and justify why you're using it. So last point is about validity. Just the idea of it in the literature was that when you place a description or a text with multimedia, you have better validity score interpretation. It does seem to have a measurement of a different construct than the text items. So it does seem that it has higher cognitive abilities. There's no medium, we can't say like CT is better, image is better. That isn't there. It just, but there is evidence that the cross-sectional image seem to test an extra skill, but you have to keep in mind that we have to give it to them more than one section. And there was this article that said extended matching questions with and without. They compared it with and without the multimedia. They felt with their analysis showed that there was different in the cognitive process, and that it measured a different skill, and it's justified as a purpose for using the multimedia version of it. Regarding reliability, it suggests that if you have a well-selected and constructed multimedia item, it's better and it improves reliability. So putting everything we said into one slide, which are the factors we need to consider, is you need to consider the purpose. So why are you going to use the multimedia in your teaching and learning? Is it relevant or not? Are you going to talk about the quality? Is it clear? Is it pixelated? You need to talk about the content, detailed. Is it detailed, or are you just going to give a whole picture? The dimensionality, is it 2-dimensional? You're going to use a 3-dimensional. Did you cover the orientation part? Did you cover the spatial ability? How is it front, back, up, down? The view, is it a single view? Are you going to give one view, or are you going to give multiple cuts of frames, or are you going to give the video of it? Are you going to, the colors, did you factor in the colors, the brightness, anterior, posterior view? And this goes to the views that we had. One of the cardiology examinations, we had that each question almost had 8 views of the echo or of the heart, and that's because they needed to make sure to understand it from all aspects. The features, is you're going to use a still image or a dynamic? Did you check about the size? Where are you going to put it, before or after? Is it going to be split or segmented? You're going to put it on the right side or in between? Did you check about all the landmarks, the rules, or the rulers, we say? So some of the residents said that in the x-ray, one of the x-ray where there was a wide mediastinum, they said you didn't put us the ruler that's on the x-ray, the measurement. And if we had that, then we could have answered the question. So those are things you have to factor in. Relation to accompanying text. So the text that's with it, the content, is it duplicated or not? Because that affects the multimedia, the level and the sequence. Is the text before or after in the teaching and the testing? The interface, so you're going to think about the screen, the size, the looping, the scrolling. So sometimes if you're going to put an image in a scenario, it might not fit in one screen, so you're going to have to scroll up and down. Is that going to cause a split attention? Is it not? Is there a way to fit it in one screen, or do you have to train them on it? The layout, are you going to put it a single question, an item, or multiple questions? The page, is it interactive? Is it just a question that they just answer, or do they have to play? Is it, and if that definitely goes to another level when we're talking about simulation. The required skill, technology, so they're going to have to be familiar with some of the computer software. The multimedia learning theories, you're going to have background about it. The subject content, so the actual content and the visual idea about it. Expectations, so what are the expectations of the students? Are they always going to think that we need to give them the classical presentation? They have to understand that sometimes you can give normal images and not exaggerated one. You have to factor in time, and of course the cost and the cut score. So because multimedia might be more difficult, you might have to think about the cut score that you're putting and adjust it accordingly. And then of course the copyright issue. And so I'll leave you with questions to think about. So can multimedia learning experience be translated into testing material after all this? Is the experience with interactive multimedia transferable to the clinical setting? So if we're going to put our effort in it, are we going to see an outcome from it? How does it affect the psychometric properties, as we discussed? Because it's not, there's very gap in the literature. So so when we look at the item analysis, we can't just rely on, I think, numbers. We need to take the input from the residents or qualitative input, as we've done the focus group, and we sat with them, we showed them the items, and we asked them why this worked, why this didn't work. And surprisingly, they have so many comments that we didn't take into account. And will students change the way they study in response to the exam? So if you had multimedia formats, where they're going to go now in the clinic and try to do more clinical? Will they pay more attention to their formative assessments and chase after it? So in conclusion, you need to be familiar with the principles, I guess. Of course, so the choice of multimedia and its relevancy, it seems that's what's most important. It can yield very good psychometric properties if constructed well. And I think we need to definitely seek feedback from students, and revision from professionals is considered vital. And by that, I say thank you. And I have to acknowledge the contributors for this presentation. And thank you for the CFHS and the Academic Affairs and the e-learning department for giving me the chance to talk. And Dr. Hatem, who is going to be our moderator now, and see the comments and questions.
طيب شكرا جزيلا دكتورة ثريا. very informative الحقيقة. بالنسبة للأسئلة, it has to be something relevant and something within the topic itself. There are lots of questions actually is irrelevant and talking about other things. I will give the chance for everyone to ask questions. I can see now طبعا الموجودين الآن till now 10,000 attendees. Not give the chance for everyone to talk. Actually, I can see a lot of hands raised. While I'm waiting for relevant questions to be written, I will give the mic to our الرئيس التنفيذي للشؤون الأكاديمية في الهيئة الدكتور وسام أبو زنادة. If you don't mind, Dr. Wissam, we need to hear your comment, please. Dr. Wissam. طيب يمكن في مشكلة مع الميكروفون حق الدكتور وسام.
السلام عليكم.
عليكم السلام، تفضل دكتور.
هلا دكتور حاتم، كيف حالك؟ الأخبار طيب إن شاء الله؟
الله يسلمك ويعافيك.
دكتورة ثريا أبدعتي، الله يديك الصحة والعافية. A very enriching presentation. I think يعني الquestions اللي هتطلع من الويبينار هذا are very intriguing on how do we visualize or how do we manage assessment in general, and how do we take care of teaching day in and day out. المنظومة at the end of the day يعني زي ما الجميع عارف الاعتماد والتدريب والتقييم it's one necklace أو سلسلة واحدة. ارتباطهم ببعض لازم يكون ارتباط وثيق. الانوفيتيف ميثودز اللي تستخدم في التيتشنج has to happen in assessment. الحمد لله شفنا شويه disruption في الاسسمنت، امتحانات شهاده الاختصاص للفيلوشيب الحمد لله تمت امس، اكملنا جميع التخصصات باختبارات عن بعد. ف thinking about pushing the envelope and getting things up and running through technology is something that we really need to look at hardly. One of these things is the teaching methodology or assessment methodology, and again alignment is critical in the methodology and in the way of doing things. الله يكتب اجرك ويديك الصحه والعافيه، وانا يعني متشوق جدا اسمع الاسئله لانه شفت اسئله جميله جدا، واتمنى من دكتور حاتم takes his time to answer those. الله يديكم الصحه والعافيه جميعا، وشكرا مره ثانيه دكتور حاتم، شكرا دكتور ثريا.
يعطيك العافيه دكتور.
ولا انسى الباك اند حقنا، معلش سامحوني،
طبعا
الليديز والشباب اللي في الباك اند اللي they manage الويبنار حقت الهيئه، سلطان، مريم، وجيهان، الله يديكم الصحه والعافيه ويكتب اجركم يا رب ان شاء الله. شكرا
دكتور وسام. دكتور شكرا. دكتورة ثريا في سؤال يقول which is more effective with the pictures, التكست يكون above or below the picture?
So the picture has to be above the text. If the picture is above, you're going to see the picture first. It's going to be easy and quicker to understand, and you're going to have a lot of capacity in your working memory to analyze the text. If you're going to put the text first, the student's going to be analyzing the text, which is much difficult, and most of the capacity in the working memory is going to be filled. So by the time it sees the picture, it won't be able to process the picture better. So above the text.
So we put the picture and then the text below it.
And then the text below. Yeah, that's the recommendation. That's the principles that they're saying. Yeah.
Okay. I see a question here about the working memory capacity. And another question about redundancy questions, and I will put the two questions together. Just correct me if I'm not, if maybe my little memory about the cognitive load theory, إنه إحنا we process 7 items in 30 seconds. So is that true?
Yeah, so it says they don't say it as items, they call it units. What is a unit? Yeah, so they're saying yes, it's kind of 6 to 7 units. That's how you can process at one given time. However, I don't know what a unit is, so maybe the unit for the novice is a few words and the unit for an expert might be different, more, but it's like 7 units. So whatever your unit of information that you get or your capabilities, that's how it's overloaded. Of course, I think I've read some that said up to 12 units, but I'm assuming that's because you have to understand these are all process that cannot be seen. It's all in the mind. These are all theories or assumptions that they think. For the redundancy, they're saying don't use unnecessary words or text. It doesn't mean that you remove them. I think so it depends. If you're giving a lecture, sometimes you need to give more words and you need to give more explanation, and it is gonna and that's where you have to see balance how to do it. It's again, it's just the idea that if you're gonna talk or give more words, make sure it's not duplicating, make sure it's relevant. For examinations, we in the commission, we always say try to make your words less, and in our workshops we always talk about balancing the options and about making the item more relevant. So you can move some words that she felt very anxious sometimes, or you, like when we say a 50-year-old female presented with the diabetes, with the history of diabetes for 7 years. Sometimes we just say a 70-year-old female with diabetes. So we just move those extra words sometimes. It's just a kind of rephrasing, but not removing the information.
معلش, I will add on that. With the text questions, for example, we say that don't exceed 100 or 120 words in the MCQ.
Mm-hmm.
Is there anything in the multimedia? Is there anything, for example, in the duration of the video, duration of the audio?
Yeah.
Is there anything on that?
So there's very little on audio. what I've seen in the video, I think maybe only 3 or 4 had mentioned it. One of them was the national board had said it, that so the idea is 10 to 30 seconds. That's what they recommend. Although the 10 seconds that we had put caused difficulty. So they recommended the video 10 to 30 seconds. However, some said 1 to 2 minutes. And I think it depends, like if you're going to give communication, or like in psychiatry, there's that talking, like there's back and forth. You give it in bigger segments. So the biggest I've seen is 2 minutes. The recommended seems 10 to 30 seconds. But again, there's not a lot of literature about it. And I think you have to factor in the time. So if you're going to put it in OSCE, you can make it longer, but you're going to put an MCQ examination. How long is long enough? And where's the item going to be placed? Are you going to put it in the beginning of the exam, the end of the exam? And you're going to have to factor in different things also.
Okay, so in summary, that you say that 10 to 30 seconds is acceptable, maybe, when we design a question. Okay, somebody's asking about the IT courses to be fit to prepare for or to deal perfectly. I didn't understand the question well, to be honest with you, but my understanding from the question that IT courses that is required, maybe this is something you can touch on. For example, if you want to use multimedia, how much IT support you need?
Well, if you're going to make the item, so I was doing self-learning, so I needed to learn about like just simple things, how to Windows Movie Maker, so how to loop the image, how to remove the audio. So these are simple things you can take. However, I'm sure that like there are items that are more sophisticated, definitely need IT programming there. But I think basic stuff, if you're making it very simple, then you can just like, it's like the cut and paste and editing and making the, so I think these are things you can see on YouTube. But to have a course about multimedia, I don't know. I'm not familiar with any.
Sure. So just try to make it as simple as you can, and to make it as clear, the pictures. I mean, the pictures as clear as you can, the sound as clear as you can,
exactly.
And also the videos as clear as you can. Okay, something I want to ask myself with the cognitive load theory. There was talking that when you read, for example, in a quiet room, maybe you need to have some sort of white noise so you can fill the cognitive load, so you can have the ability to process the information while you are reading, like a music or something. It will make it easier. Is that true?
Oh, I haven't come across that. I'm not sure, but again, if you're gonna have auditory information and you're gonna read, you're gonna have so it can, so it's the same idea. So yeah, it's the same idea as multimedia. So if you're gonna see a video and read, which makes it better. So I'm assuming if you're gonna listen to something and read, it's gonna be the same thing, because the auditory, the hearing is not gonna interfere with the thing that you're reading, the picture, because the words are going to be translated as pictures. So, but again, it depends. Are you a person who gets a split attention? Are you a person who cannot process both things together? And that's going to affect you, depend on your learning style.
Very good. Dr. Saleh, where do we put the multimedia on the Miller pyramid?
Well, it can be as simple as a recall if it's very clear, but I'm assuming it's going to be of knows how. I don't know if it's going to show how, but I'm assuming as knows how. Unless it's interactive or simulation, then it could be maybe as it does, but I would say higher up analysis. So some articles and say that yes, it goes up to the high of Bloom's taxonomy also of analyzing, interpreting, and so on.
And do you think that the higher we go, maybe the better it will be? I mean, more useful to go for higher exam. I mean, higher level in the Miller, better than just to go for nose.
I think I feel after being exposed to this, I'm more of an advocate of using multimedia, but in the formative assessment mostly. I know in the final you have to cover more things, but I think the formative assessments give us a very big area when you're relaxed and they're relaxed and you have very good information to use that. And I would say yes, because if you are a pathologist and you're looking at slides all the time, or a histologist, or you're a radiologist, what's the point of taking the items image text-wise when you're supposed to be seeing it? And of course, that's going to depend on the specialty. If you're an orthopedic or even a OB-GYN, you would see lots of ultrasound. So I would advocate for seeing more. I'm not saying put more in the final exam, but I'm assuming that throughout the work-based assessment or the formative assessment, I assume that would be a very good area, a safe area to try it and to increase, to go to the know-hows. So when they're in the clinic, you might say, oh, they know how to read or interpret an ECG.
Very good. Okay, Dr. Yasser Fadin is saying that he's usually sleeps very early, but he's so much enjoying the lecture, your lecture, so he's not sleeping early tonight. Other questions actually. Another, maybe ناخد واحد أو اثنين. Will multimedia change the teaching methods for clinical learning and clinical rotations?
I'm guessing maybe yes. I think everything is going to change, especially in the situation that we're in with the COVID and everything. But even before that, I think if you have more multimedia in examination, definitely the assessment is going to change. And if you have more multimedia in the training, they're going to know that's going to come in the teaching, in their examination, so they're going to prepare for it. And I think that's what we've realized. And to be honest, a lot of the literature says that they felt more comfortable with multimedia images because it felt that they were in the clinic, it was much realistic to them. And I'm assuming after all this, it would.
Good. And there is another question or suggestion that maybe we should include it in our teaching and designing instructional methods now to include more and more multimedia.
I think so, yes. Because there was one code that said that a modernized teaching method requires a modernized assessment method. So if we're all going to online and and a lot of the examination, USMLE, Royal College, National Board, they all incorporated multimedia in their examination. So you need to, and some of them, some universities like Stanford already incorporate in their instruction, in their curriculum. So they added it as instructional material in their curriculum.
Okay. Dr. Saleh Hassef يسأل برضو, can we use a psychometric analysis on the multimedia questions? أنت جاوبتي بس ممكن يعني to add quickly.
Yes, you can, but I think I look at the psychometric analysis of the multimedia now differently than I used to see it before. So I used to just look at the numbers and say good, bad, okay. But now I think, especially multimedia items, I try to read very deeply into it because if it was more difficult or more easy, it doesn't seem to represent the true action that happened. So I'm assuming they're good, but you need to select those that didn't perform well or those that even performed really well, and you take that group and you ask the residents or the students why and why not, so you can adjust accordingly to it.
Okay. في another question الحقيقة is talking about the study material نفسها, how to change it. يعني نفس الكتب الآن أنا ألاحظ حتى الكتب الآن يعني a lot of e-books, it has a lot of multimedia nowadays. When you download the e-book ممكن تتلاقي فيها sounds, ممكن تتلاقي فيها videos أكثر من أول يعني.
ماشي دكتور كان يقطع. You're saying a lot of books and materials have multimedia?
واحد بيتكلم بيقول إنه الآن البوكس المفترض إنه يكون فيها, فأنا ملاحظ إنه a lot of e-books nowadays when you download it to your tablets or your mobile, you can see a lot of multimedia موجودة فيها. يعني تلاقي فيها videos, تلاقي فيها audios.
Yes, true. Yeah, a lot of them do, but it doesn't mean that it's portrayed or given in the correct way. So sometimes even me, when I see some videos, I just get more confused or it doesn't resonate for me.
Okay.
So I'm not saying it's not good, but I just think you just need to make sure that the receiver, you have to have feedback from the receiver. Otherwise, you'll never know what you're doing and the effort and the money that you're putting, is it worth it or not?
To make it so fancy and then you lose the receiver. طيب, and I think we have to stop here actually لأنه دخلنا على ساعة ونص الآن. I'll give you the chance to add anything extra, دكتورة ثريا.
I think that thank you everyone for coming and participating. I hope it wasn't too dense or boring. I know it has a lot of concept, and this is just, as we say, touching the tip of the iceberg. I myself have a lot to learn, and I'm sure that there's a lot that I haven't covered, and there are experts there who knows. But just thank you everyone for coming, and those who are waking up now or sleeping. Thank you very much for taking the time.
طيب, thank you very much. I have to thank actually أستاذة جيهان, الأستاذة مريم, ونشكر طبعا الدكتور وسام أبو زنادة على إتاحة هذه الفرصة لنا جميعا، وشكرا لجميع الحضور. وبالنسبة للأسئلة الحقيقة بعض الأسئلة عن CME hours وعن اسمي مكتوب أو ما مكتوب، الحقيقة صعب جدا لأنه 10,000 attendee، فصعب جدا نجاوب عليهم كلهم. Thank you very much everybody، وإن شاء الله تعالى نشوفكم في ويبينار قادم جديد بحول الله. شكرا جزيلا.
Thank you.
العافية دكتور حاتم.